Okay, so in this video, we're going to be doing postpartum assessment and fetal monitor. I'm going to do my postpartum first, but in real life, you do the fetal first because that's before the baby's born. But just the way I had my notes written down, the way I studied, I'm just going to do it like this. So I have my friend Briston here. She's helping me out, and we are going to start. She is over 18, so she can be used in my skilling purposes. Okay, so we're in the patient's room. We're going to enter, do some hand hygiene. Hi, my name's Jared. I'm going to be your nurse today. I'm going to be doing the postpartum assessment. Can you tell me your name and date of birth? I'll go ahead and get some gloves on. She tells me her name and date of birth. I'm going to look at her wristband. It's the same patient. Ask for allergies. Before we start the postpartum assessment, we're going to ask them if they've urinated. If they haven't, they need to get up and urinate, or we need to wait till after they urinate because it is very important to do this after they have urinated. So she says she just urinated, and that's fine, so we're going to get started. So I'm not actually going to expose the patient because it's a real person. In real life we would, and for skilling on the dummies we would, but I'm not going to do that. It'd be a little bit awkward. So first we're going to start by we're going to do bubble heap for our postpartum assessment. So we're going to start at the breasts. So we're going to expose the breasts, make sure they have a bra on. We're going to look at the breasts. We're going to check for redness and engorgements. If they're breastfeeding, we're going to check for cracks, bleeding. If they're not breastfeeding, we're going to make sure we teach them how to not stimulate breast milk production. So the breasts looked fine, they look normal. Now we're going to move down to the uterus. And before we do that, it's very important that we auscultate before we palpate. So I'm going to go ahead and pull out my stethoscope. We're going to listen to bowel sounds. We're going to check all 4 quadrants. So we're going to make sure they're present and active in all 4. They are. If they're absent in all 4, we'd immediately call the provider. Now that we've done that, we're going to make sure that the uterus and everything's firmed up. So we're going to put one hand at the bottom and one hand at the fundus, which should be about now at the midline, maybe one finger above, maybe one finger below. It is. We're going to make sure it's firm. If it's not firm, we're going to do a fundal massage, try and get it firm because that's one of the #1 causes of bleeding after birth. At this point, we're going to ask them about their bowel and bladder habits. Have you been having bowel movements as normal? What's the consistency?
Yes.
Okay. And then we're going to ask about bladder. Has that been normal?
Yes.
They said yes. Okay. So now we're going to move on to having them turn on their side. So if they would turn on their side, you don't have to if you can't. We're kind of using a piano bench, so it's a little awkward. So when they're on their side, we're going to inspect for lochia. We can look for hemorrhoids. And we're going to check for bleeding. If their bleeding should be scant or lowly, like moderate, it shouldn't be a lot. If it's heavy bleeding, filling up the pads, we need to notify the provider because something could be really wrong. So there's no hemorrhoids present. At this time we could do pericare. If we did, we put on a full clean pad. There wasn't, no hemorrhoids were present. We would check for lochia, that's all good. Now we're gonna change our gloves and do hand hygiene. We have clean gloves on. We're gonna move down to the lower extremities. We're gonna check for any redness, pain, especially one-sided pain. That can mean something's extremely wrong after birth. There's none present, no pain, it looks normal. We're going to start checking for edema in the lower legs, arms, and face. There's no edema, everything's normal. Went through, looked, we checked for edema everywhere, there's none. So all that adds up. So the last thing to do on our postpartum assessment, we need to make sure we ask about emotion and bonding. So have you been connecting with your baby? How has that been? Have you been bonding with your baby?
Yes.
Okay, so that all adds up. That's about the end of the postpartum assessment. So at this point, we take off our gloves, ask them if they need anything, put the bed down, make sure they have their call light, provide for privacy. We would go document, tell them we're back to check on them. Same thing like before we entered the room, we did all that stuff. So now we're gonna move on to the fetal monitor, which would normally happen before you would do a postpartum assessment, just the way my notes were. This is how it's playing out. So we're gonna enter the room, we knock, introduce yourself. Hi, my name's Jared, I'm gonna be your nurse today. I'm gonna be applying the fetal monitor. Can you tell me your name and date of birth? I'll check the wristband, ask if they have any allergies. So I do my hand hygiene, put on some clean gloves. So we're gonna start by applying the Toco transducer. It's got the little ball on the bottom of it. We're gonna place that on the apex of the uterus. So we would have expose the patient. I'm not actually gonna expose the patient because it's my friend, it'd be awkward. So I'm gonna expose the patient. We're gonna find the apex of the uterus. And we are going to attach the Toco transducer up here. It's going to measure the contractions. So after we strap that on, it's ready to go. And then now we're going to apply the ultrasound, which we're going to start by doing the Leopold's maneuver, and that's going to be feeling around for the spine, usually over here on the side of the patient. We're going to try and find the spine of the baby, feel for the point of maximum intensity of the spine, and that's where we're going to place our ultrasound. So we're going to feel around, do our Leopold's maneuver, we find the spine, we find the point of maximum intensity. So we're going to apply the ultrasound here. We're going to make sure we use our jelly if it's needed. We're going to get that in place until we find the heart rate, which should sound like ba-boom, ba-boom, ba-boom. We're looking for 110 to 160 beats per minute. That's average for a healthy baby after birth. So we have that applied. It's in the right spot. And at the apex of the uterus, that's also called the fundus. So we would make sure we did that too. So we have those both applied. I'm going to cover our patient back up, provide for privacy, take off our gloves, do hand hygiene, put the bed down, make sure the patient has the call light, ask them if they need anything. Do you need anything?
No.
No? Okay. So they don't need anything. We're going to let them know that we'd be back in about 15 minutes to check on them. I put the head of the bed up to wherever they're comfortable. And at this point, we'd go document after we let them know we'd be back to check on them. So that is the fetal monitor and our post assessment.